girl gang, it's Dr. Joy here, and my BFF, Dr. Kamesha, is joining me today. You are watching Delivering Joy MD, and today we're going to be talking to you about a topic that many women talk about on a daily basis, and that is vaginitis. So we know you need all of this tea, honey, so make sure you keep on watching.
Vaginitis, aka vaginal odor, discharge,
irritation,
foul,
ooh,
fishy.
You don't want to miss this, girl gang. Yes. We're getting into it. All right, girl gang. So today we are discussing vaginitis. That's vaginal discharge, vaginal odor, vaginal irritation, vaginal itching, all that stuff that we always worry about. But before we get into this video, I gotta give a couple of shout outs. First of all, you know I got my hair flat iron here. You know I got it down. I got my pink and green on today because I want to give a shout out to my sorority sister, Senator Kamala Harris. Shout out, excuse me, my soror, yes. And my second shout out is to one of my favorite YouTubers, Patrick Starr, who did this beautiful makeup, this one size fits all palette. And I just stole this look that he posted yesterday. Okay. So I'm real happy about that. See, Patrick, can you see? See, Patrick? Yeah. House of Star, baby. So now let's get into this actual video because you know how I can get sidetracked sometimes. So Dr. Kamesha and I have written down our most important tips about vaginitis, and so we're going to be talking about that. So Dr. Kamesha, how do you kind of start this conversation with your patients in the office?
Generally, they started with me.
Yeah, exactly. They're like, something ain't right down there. That's usually how this conversation.
And when we did the hygiene video, I said we've got to get back together and talk about to douche or not to douche. And this is all going to tie right into that. But we're keeping good hygiene because we've got that on lock now. When do you need to call me up? When is over the counter?
Like I say, know when to go.
Yes.
Okay, you got to know when to go.
First, yes. Let's talk about that because before we start doing all these other things and you've tried your over-the-counter products, but you are itching and it is so uncomfortable, it's interrupting your sleep, or you find yourself in the bathroom and you're rubbing that area so hard with toilet tissue, my patients
and washcloths.
Right.
They get a wet washcloth and just scratch.
Just scratching.
You know, so no, that's none of that is normal.
No.
You should not be irritated. One of the things you find when you itch like that and you scratch, that it burns when you urinate. So a lot of women will say, well, I think I have a urinary tract infection. No, you've been scratching and rubbing the vaginal area so much that actually you've developed little tiny abrasions, like you skin the skin off, like you scratch the skin off, and that's why you're burning on urination.
And then we have the foul odor. And there's a difference between foul, that's rotten, sulfur smelling, and then you have the fishy odor.
Fishy. So this is a for real medical fact, but I just think it's hilarious that when a woman has bacterial vaginosis, which is the first type of vaginitis that we're going to cover today, they have a very specific medical test called the whiff test. Like as in, you can smell it.
Yeah.
And it is so hilarious to me that after doing this for the past 11 years, I can walk into a room and know the difference between BV and the difference between trichomoniasis or trick, which is another vaginitis that we're going to cover today.
Right.
So that whiff test thing is for real. It really is for real. And the practiced nasal
immediately
nasal nares can smell it immediately and know exactly what it is when you walk in the door. So sometimes, I mean, I always do the testing, of course, but I can usually tell just on smell.
And I want to say at the outset, seek help first.
Right. And I think it's totally okay if you've got, if you think you have a yeast infection and you want to pick up some Monistat cream from the pharmacy, okay, go ahead. But if you're not feeling better within, 3 to 4 days, you really need to see a gynecologist.
And everything is not yeast. and sometimes we can get dismissive. And we want to make certain that we're not missing an actual sexually transmitted infection. And I'm always sharing this with my patients about this discharge, because these different types of STDs can cause such inflammation that it can cause blockage of your fallopian tubes. And everyone wants to be in control of their family planning and future fertility.
Correct.
And so we don't want you to have blocked tubes and delaying and assuming that everything is yeast.
Don't delay and don't deny.
Right.
So I have seen patients with copious amounts of discharge coming from the vagina, and I'll say, well, have you been having discharge?
No.
And they're like, no. Honey, you in denial. There's no way that you don't see this, what I'm seeing right now. This is a lot of discharge. So don't be in denial and don't delay going to seek help if you need, because like you said, Dr. Kamesha, there are a lot of sexually transmitted infections that can lead to some pretty serious pelvic infections that might even, not only decrease your fertility, but may make it to the point where you need a hysterectomy. I recently had to do a hysterectomy on a young lady that had pelvic inflammatory disease, and she was under 30. And so now she is missing her ovaries, her uterus, and her tubes. And so vaginitis can be very serious because the vagina, of course, is connected with the cervix and the uterus and the fallopian tubes and the ovaries. And so that infection can spread up into the pelvis. And so you want to make sure that you are staying on top of that. It's pretty rare for serious, pelvic inflammatory disease to occur.
Progress that
but when it does, it can be pretty life-changing and devastating. So let's hit the specific types of vaginitis today so you kind of understand each one. Vaginitis type 1 is bacterial vaginosis. So, what exactly is it, Dr. Kamesha? What is it?
It's fishy. That's what it is. I don't have to get into all the Gardnerella.
Spit my tea out.
It is fishy. And let me tell you, this thing, patients will come in and say, hey, I was being intimate, everything was fine, but afterwards, the room, they were like, Doc, it was bad. And that is definitely bacterial vaginosis. I can get into the specifics of, but honey, listen, it's fishy. That's what it is.
And that is really just because the chemical balance in bacterial vaginosis has been thrown off. So the vagina likes to stay what's called an acidic pH. And if you've ever heard of the pH scale, you know that 7 is neutral. And then anything below 7 is considered acid. And anything above 7 is considered base. So the vagina has a special normal bacteria in it that's called lactobacillus. And lactobacilli are the bacteria that produce this lactic acid, and that keeps the vagina the normal pH, which is usually around usually between 4 and 5 is where the vagina likes to hang out. Now, different things like your menstrual cycle, sex, using soaps that have a basic pH can increase your risk of getting bacterial vaginosis. And so you want to be careful. Even some products that we don't even think about, like the dye in our underwear, can cause us to have vaginitis. And so any kind of chemical that you're putting in the vaginal area affects the chemical balance. And so you want to be careful about that and make sure that you are careful with what products you're using down there.
And listen, I'm always going through this with my patients. Whenever you get close to your menstrual cycle and that blood inside of our womb, inside of that uterus, begins to release, it is going to neutralize that natural normal acid. That's a normal cycle of life. You can't change that. Okay? And so during that phase, you're going to notice that you're going to get more bacteria that's going to grow. And this is why the hygiene is so key when you're on your cycle. But once your cycle then subsides and then that normal acid comes back, that fish odor, if it's pungent and it's strong, okay, now we're dealing with an infection. You need to come on in and be seen.
Absolutely. I totally agree. And so, many things can neutralize the vaginal pH. And then you get harmful bacteria that grows. And the most common bacteria is called Gardnerella, and that's usually what we're testing for. But there are other things that can cause bacterial vaginosis. And I talk to my patients a lot too about partners. So, sexual partners, sometimes sex can increase your risk of bacterial vaginosis. That doesn't necessarily mean it's sexually transmitted, but especially in my ladies who may have partners who are uncircumcised, making sure that they're cleaning really well behind that foreskin is really important. Because when the penis becomes hard, the foreskin retracts, and then there may be a whole layer of bacteria that just has not ever really been cleaned well. So you want to make sure if your partner's uncircumcised that you're paying attention to that, and having him pay attention to it too as well, especially if you find that you're constantly in the gynecologist's office for a bacterial vaginosis infection. And I have had some women who have had to have their partners treated so that they can avoid having recurrent bacterial vaginosis. And so bacterial vaginosis is pretty easily treated.
Yes.
We can use different products to treat that. Usually an antibiotic is what we're going to give, and that can be given in a pill form, or also there is a vaginal gel that can be used. There are a couple of other preparations like clindamycin, and there is a clindamycin vaginal prep that's good, that's out there. So there are lots of different ways. Some women prefer to use a boric acid type of suppository, but my question, Dr. Kamesha, is to douche or not to douche. Should I douche if I'm having like a bad odor? I mean, I thought that'll clean everything out.
No, please stop with the douching. We should not add these detergents to that vaginal area. Listen, when you start adding these betadine douches, you're going to break down that natural barrier that exists.
So true.
And you're going to get even more infection, even more bacteria. And it's going to be the anaerobic, the foul gas forming ones that you don't want.
Ooh, you can tell those when you walk in a room. And so I think it's really important that we pay attention to that. So, I know aunties and mamas and grandmamas have said to douche, but let me tell you, me, board certified OBGYN says, do not douche. So the question is to douche or not to douche. The answer is no. So don't douche. That just makes the whole situation worse. It makes it more difficult to treat that infection. So bacterial vaginosis usually causes a thin, watery type discharge that has a foul odor, and it's usually worse after sex because when semen mixes with it, it's funky. Okay, so that's a good clue that you may have bacterial vaginosis. Okay, moving on, let's talk a little bit about yeast. And so yeast is usually going to be, the vaginal pH is going to usually be pretty normal with yeast, and you may see some discharge, usually like a thick kind of cottage cheesy type discharge. And the big thing with yeast that most women come in talking about is irritation and itching. Usually. Irritation and itching. And yeast infections can be caused just by an abnormal balance in the vaginal neighborhood, is what I like to call it. So the bacteria, there's yeast, and they usually live together in harmony. But when yeast kind of starts to overgrow the healthy bacteria, then you get a yeast infection. It's very important if you have or you think you have a yeast infection that we are treating that so that you're not constantly itching and scratching and then getting an infection where you have scratched the skin off, because that's a whole nother problem on top of the yeast.
A super infection.
That's
right. It's an infection on top of another infection.
Exactly.
Let me just add a little tidbit in for my diabetic patients. It never seems to fail. My diabetic patients, they struggle with that yeast. You got to get that blood sugar under control because it is impacting your immune system. And so you're not able to keep a healthy balance of the bacteria and the yeast. And they struggle. My diabetic patients struggle the most with that yeast infection.
And two, if you are having recurrent yeast infections and you ain't been to the doctor in a while, you may want to go and be checked for diabetes, because with all that sugar in the vagina, the yeast just loves it. Like they
multiplying.
Eat it up. They just down there just like baby's kids.
Yeah, multiplying.
Just multiplying and dividing.
Yes.
So you want to make sure that you get that blood sugar checked. And that's actually part of your well woman exam that you should be having each year, is a blood sugar screening to make sure that you don't have diabetes. The other thing I see with yeast is women who have a very high carbohydrate or high sugar diet.
Yes.
So you may need to get rid of,
sweets.
you know, we love dessert. We love dessert.
I love dessert.
But we need to be cognizant of what we're eating and drinking. And the same thing goes for bacterial vaginosis. To keep a healthy vaginal neighborhood, we must drink water. I recommend at least 64 ounces a day of water. And we have to make sure that we're on top of our hygiene. And we got that video posted for you in the description box. So got that hygiene on lock. And then, you know, after we've kind of dealt with bacterial vaginosis and yeast, we have to turn our attention to sexually transmitted infections, specifically gonorrhea, chlamydia, and trichomonas.
Yes. These particular bugs, they like to cause that foul odor.
I can almost smell trichomonas when I walk in a room too, and it usually
very distinct.
The discharge is almost like a frothy, like if you've ever seen the top of a beer, like when someone gets a beer on
bubbles.
tap, it makes little bubbles. And when you look in there, you can actually see the bubbles. And it usually causes the cervix to become very inflamed, and so you may also see vaginal spotting in between periods with trichomoniasis. And I know that's a big word, but we refer to it as trick. And trick can be tricky. So, you know, I always tell my patients that, because they're always trying to figure out, well, where did it come from or who gave it to me? Trick can be tricky. So you want to be, cognizant and making sure that you are going and getting your health screenings at least annually. I always tell my patients, if you have multiple sex partners, you may need to come every 3 to 6 months just to make sure that you're being screened appropriately. And of course, I know that you're using protection and condoms if you're part of this girl gang, right?
That's right.
Okay. So trichomoniasis is certainly one, and that is easily treatable as well. We usually use antibiotics, and it's just like a one-time dose.
Right.
You know? And you'll find that most of the treatments for these bacterial STDs or sexually transmitted infections are one-time doses. So do not delay. These things can be cured quickly if you act fast.
And there are the consequences of them and not being treated in a timely fashion. They can just have long-term consequences.
Absolutely. And so you want to make sure that you don't delay. Gonorrhea is another one that I think is not as common as trichomonas and chlamydia, but it's definitely one that can be much more threatening in terms of your sexual health and your reproductive health. Gonorrhea is a bacteria that can infect the cervix or the vagina, and it usually causes pretty bad symptoms. Like with gonorrhea, you're much more likely to have pelvic pain and just really thick and usually even colorful discharge, like yellow, green, brown colors, and it's usually pretty noticeable. So gonorrhea infections pretty much are often symptomatic, but they can have no symptoms at all. But this is one that usually can be what we call more virulent, or it multiplies faster and it gets up into the cervix, the uterus, the fallopian tubes, the ovaries. So gonorrhea is notorious for causing what's called pelvic inflammatory disease, and that's what you want to avoid.
Yeah, and that chlamydia, just on the other hand, that one does like to sit and be silent and asymptomatic. No discharge, no itching. You just came in for a routine check, and then
it's positive.
So not all the time do you get that discharge or you get some discomfort. Some of these can sit around there, and I have patients that come in and say, I haven't been active from however long.
Right.
Yeah. It requires not just any antibiotic. I'm always telling my patients, you have to be treated with the right antibiotic.
Absolutely.
Because I've learned from patients, have you seen that? Well, they're like, well, I couldn't possibly, because I went to the emergency room and I was treated with an antibiotic for, when I had an upper respiratory tract infection. I'm like, oh, yeah, but that one won't treat your gonorrhea.
Right, exactly.
That one's not going to treat your chlamydia. Matter of fact, gonorrhea, chlamydia, and trichomonas, they're all treated by different antibiotics.
Yes, need multiple. So you need a triple antibiotic therapy if you have triples. And so, if you think, and it's perfectly okay, in my opinion, to treat a patient who's coming in who has, pelvic pain, they have vaginal discharge.
Right.
I will give them triple antibiotic therapy even before the testing comes back. Because we can send a urine test. We could also send a vaginal or cervical swab to detect gonorrhea, chlamydia, or trichomoniasis. We can also detect BV and yeast on these swabs, and it's usually just one test that's sent. Right. But it can take 3 to 5 business days to come back. And I'm like, look, if you got something going on like that, you ain't got time for that 3 to 5 days. No delay. We go ahead and treat.
Yeah.
See and treat. That's one of those conditions that we see and treat. So our top recommendations, what are our top recommendations for avoiding vaginitis?
Hygiene, I'm gonna say that.
Hygiene's her fave. Yeah. Mine would be, and believe it or not, I think this is good for women, period, is adding a women's health probiotic. It's good for your gut. It's good for the vaginal neighborhood, and for just promoting overall good health. I love a women's health probiotic. I'll post a link to the one that I use in the description box down below, but there are many that are available in drugstores and grocery stores all over. But also eating a healthy, balanced diet. Water are super important too, to avoid vaginitis and to keep your vaginal neighborhood as it should be. And then, of course, safer sex.
Absolutely.
Safer sex. Because, just because you're on birth control does not mean that birth control is going to protect you from the cooties. Birth control does not protect against the cooties. Condoms do that. And also just
barriers.
Barrier method. And being selective about your partners, and I think it's totally okay to be very sex positive, to enjoy sex.
Absolutely.
But be careful out here. You don't want just anybody doing anything to your body or putting stuff in your body that you don't want, that you have to have antibiotics to get rid of out of your body. You know what I'm saying?
Yes.
Yeah. So the other things, what about like baths and perfumes and things like that? I really tell my patients, avoid that in your vaginal area. The vagina is not meant to smell like
these detox pearls and all of these things. I just don't understand why we putting garlic, strawberries. We put so many. We don't need those things.
The vagina is a self-cleaning oven, y'all.
I like that.
You just need to leave it alone. Wash it with, have a pure soap. Use a white washcloth or your hands. Get them soapy. Clean that area. Make sure you elevate that leg. Get in those crevices. Make sure you have full access into the major and the minor labia. And if you don't know your lady parts, my video on learning your lady parts is linked down below. But you need to know those parts so that you can make sure that you are on point when it comes to keeping that area clean. The more harmful bacteria you get rid of, the better. So that way your body doesn't have to constantly keep policing that bad bacteria. Policing. You got to police it, honey. So you can make sure. So you keep that area nice and clean. Whatever is touching your skin should be clean white cotton. So if you're wearing purple, green, blue underwear, you may want to consider a liner if you are a person who gets frequent infections. And sometimes wearing liners and pads every day can cause chafing.
Yes.
Between the thighs, and even cause some chafing in the vaginal area. Yes. And if that's you, make sure that you are just, if you're not having bleeding or discharge, make sure you leave that off at night. Let that area completely dry out. And then make sure that you are applying some sort of skin protectant if you're wearing a pad or a panty liner every day. And that could just be as simple as Vaseline or A&D ointment is what I usually suggest that my patients get. Because if your thighs rub together, and you tend to have a lot of moisture in that area, you need to make sure that you have a skin protectant so you don't get skin breakdown and skin rashes.
Let me tell you one little simple trick, girl gang, before we go. If you have more of that moisture, just some simple pure cornstarch powder, just a little bit. That cornstarch powder, it will just a little sprinkle in your underwear. I'm not saying the whole bottle, just a little sprinkle.
And we're saying cornstarch powder because talcum powder has been linked to ovarian cancer. So make sure you pay attention. Don't just go get any powder.
Cornstarch powder.
And I usually say just put some in the palm of your hand and kind of dust it and then pat right in between those thighs.
It will take care of that moisture. That cornstarch.
Pull it right on out, girl.
It just absorbs it. I'm telling you, it'll do it. We just love this opportunity to be able to talk about this foul and fishy odor.
And so vaginitis is definitely a very common problem.
Yes.
There is no shame in going in to see your gynecologist right away.
Tell me whatever.
You know, you can tell us whatever. We're your good girlfriends. And that's why you are part of our girl gang. So if you have questions, if you've got comments, you can post those below. And we are going to see you on the next video. Make sure you subscribe so you don't miss it, girls. Peace out, girl gang.
See you soon, girl gang. Don't forget to subscribe and comment below.